Hey everyone, John here from Foundations Medical Informatics. Today we'll be talking about CD4 counts. First, we're going to talk about what CD4 cells are. Then we'll address CD4 counts and why they're important. And last of all, we'll discuss the application of CD4 tests in managing HIV. First of all, CD4 cells are often referred to as T cells, or CD4 T lymphocytes. These terms are interchangeable as they all refer to the same thing. CD4 cells are a type of white blood cell which are responsible for alerting your body's immune system when they detect potential intruders, such as viruses or bacteria. When a person is infected with HIV, the virus begins to attack and destroy the CD4 cells in the person's immune system. Over time, if enough of the body's CD4 cells are destroyed, it becomes difficult for the immune system to detect and react to infections. A CD4 count is a test used to determine the levels of these CD4 cells in the bloodstream, and it serves as an important indicator of how well the immune system is working. The CD4 count of a normal person ranges from 500 cells per cubic millimeter to 1,200 cells per cubic millimeter. If an HIV patient's CD4 count falls below 200, they're at risk for more and unusual infections. Because of this risk, they're considered to have developed a stage 3 HIV infection, better known as AIDS. During the first visit with your HIV care provider, a CD4 count will be taken and that level will be used as a baseline measure. When your HIV care provider looks at your CD4 count result, they're primarily looking at two things. 1. Your total CD4 levels, and 2. The trend of your CD4 level change over time. By analyzing these two factors, they can determine whether or not to start you on antiretroviral therapy, commonly known as ART. Though antiretroviral therapy is now recommended for all patients with HIV, the urgency to begin antiretroviral therapy is greatest in patients with very low or rapidly falling CD4 levels, as both of these indicate that the HIV infection has progressed to the point where it has or is in immediate danger of significantly hindering the immune system. After you've been started on antiretroviral therapy, it's recommended that your HIV care provider order a CD4 test every 3 to 6 months. With each test, your provider will analyze your CD4 levels to gauge the effectiveness of the antiretroviral medication. If the treatment proves to be successful in raising your CD4 levels, then your HIV care provider may adjust your testing schedule to only having a CD4 test every 6 to 12 months. Also, it's important to note that your CD4 count can vary from day to day. This is often caused by the test being done at a different time of day, or whether you're currently experiencing an infection or an illness. Because of this, it's the overall trend in your CD4 levels which is most important, not each individual test. To summarize some key points, remember that a normal CD4 count is between 500 and 1,200 cells per cubic millimeter. A CD4 count of less than 200 is one of the qualifications for diagnosing AIDS. An initial CD4 count will be taken to measure your baseline CD4 levels. A CD4 count should be taken every 3 to 6 months when starting antiretroviral therapy. And if the medication effectively raises CD4 levels, a CD4 test may only be needed every 6 to 12 months. And lastly, remember that each CD4 count can vary based on many factors which affect the body's CD4 levels. It's not each individual test which is most important, but the overall trend. Well, that about wraps it up for this Foundations Medical Informatics video. Feel free to leave a comment or send an email if you have a question. And as always, thanks for watching.